Good morning.
I welcome you to today's session. I would like to introduce today's presenter as well as my good professor, Dr. S. Veeramani. I have to introduce himself uh, for his experience and what are the achievements he has done. Dr. S. Veeramani, assistant professor of English from Government Arts College, Kulikalai, Karur. Actually, he has completed his UG, PG, MPhil, and PhD from St. Joseph's College, Tiruchirappalli. It is under the control of Bharathasan University. He's having 14 years of experience in teaching field, having 9 years experience from St. Joseph's College at Tiruchirappalli, and 2 years experience from Aringer Anna Arts and Science College from Namakkal. And from 2013 to till date, he is working in a government arts college, Kulitalai, Karur. It is in Tamil Nadu because the maximum participants have come from some other states. He has published five national and 11 international works and theses. He has attended 17 seminars and some other training programs. He has acted as a resource person in 30 programs. Uh, he has acted as a doctoral committee member, a research advisor, external examiner, and IQAC coordinator. He has published two books entitled with The Rudiments of English Communication and Literary Theories. Has received many awards like Kanavanayagan, Sangha Tamilar Best Faculty Award, Professor Ravindran Award, um, and I, I hope he will going to do his best and all the best for this session. Thank you, sir.
Thank you.
I can hand over this session to Dr. S. Veeramani, Assistant Professor.
Okay. Thank you. Yes,
Thank you, sir.
the management of Valur College of Arts and Science, Karur, and my student friend, and now he is a colleague in the Department of English in Valur College. That is Mr. Dinesh Kumar, and other colleagues and fellow members, and my dear participants of this session today. Good morning to one and all gathered here virtually. I mean, the gathering in the form of a virtual. Okay, my session today is very relevant. The topic is very relevant, and it is uh, in medical field. At the same time, in the literary field, this topic is very relevant. So in that case, I would like to give some lights upon what is a medical humanity. I would like to share my screen. The presentation you can view step by step for your better understanding. Yes. Dinesh Kumar, are you able to see this?
Sir, clearly your PowerPoint is shown, sir.
Okay, thank you very
Okay,
much.
thank you.
Yes, it's a medical humanity. I'm going to present it today, and it is what should I say? Why study medical humanity for the first time? Before we take a plunge into what is medical humanity, and we must know something about why do we study medical humanity. Medical science is different from humanities. You know that. Science is different from arts. That is also, you know that. So here, what we do is we are connecting two different areas, of medical science and humanities as a one. How we are going to connect it? The first point, why do we study medical humanities? The symmetrical relationship between physician and patient. So that's the point here. when a person, I mean a patient, patient goes to a doctor, and he has to have a good relationship with a physician. There should be a good relationship between a physician and a patient. So that's why I tell you that it is a symmetrical relationship between patient and physician. If a patient fails to have a symmetrical relationship from a doctor, his ailment is still aggravated. It is still aggravated. It is a psychological one. So in that case, we must have a symmetrical relationship. The second point is, it is to narrate the ailments of a person patient in different contexts. So a person from a rural background, a person patient from a city background, from a township background, from a urban background, suburban background. So we find that a person patient is from different fields, different areas. So how the doctor is, I mean the physician, okay, the physician is able to understand a person who comes for treatment, and he has to narrate the ailments in a proper form, and the physician also must understand because of the narration given by the patient person. The third point, why do we study medical humanity? It is to make and promote empathy and sympathy towards a patient person. Many physicians, okay, many physicians right now, they fail to have empathy and sympathy. They simply depend on the technological diagnostic processes, and they are not able to speak, and they are not able to, the physicians, they are not able to spend time with a patient person. So the physician should have the empathy and sympathy. So in order to promote the empathy and sympathy, we have this medical humanity. So that is why we study medical humanity. And then another point to make is, it is to promote medical ethics. It is to promote medical ethics in the sense, already they would have studied, the physician would have studied medical ethics and how they have to practice and all these things in their clinical practices and so on. But in spite of it, this literary text, what we read, what we have as a literary piece, it must promote the medical ethics through our reading and so on. And then another point, the last point, why do we study this medical humanities? It is to contribute literary text to medical practice. So we are not offering any diagnostic techniques. That's a very important point you must have in your mind. We are not going to give, we are not going to promote, we are not going to explain about the medical diagnostic techniques and so on. But the thing is, we are going to contribute something to the medical practice through the medical humanities. Okay, so for these reasons, we have this study of medical humanity and so on. The next slide, it shows that yes, the origin and development of medical humanity, the origin and development of medical humanity, you find that actually it started in 1960s in American schools. This particular study called the medical humanity, it started in 1960s in American schools. At the same time, it is a kind of interdisciplinary. It is a kind of a interdisciplinary. Before we take a plunge into what is the exact medical humanity from the literary examples, I would like to tell you the definition for humanities, definition for social science, and definition for the arts. Humanities, that is comprised with literature, philosophy, ethics, history, and religion. And social sciences, which consists of anthropology, cultural studies, psychology, and sociology. and the arts that is mixed with literature. Again, we find that literature, you see the importance of literature here. Literature, theater arts, and filmic studies and filmic criticism and visual arts. So these are called humanities first of all. This medical humanity is not only not only is from the use of literature, but also all the philosophies and ethics and histories and religions and psychology and sociology and cultural studies, especially the cultural anthropology and medical anthropology. Okay, and literature also, as we are taking right now. And this is like medical ethics, more like medical ethics. We are going to promote the medical ethics through medical humanity. And it is to maintain a good relationship between, as I told you earlier in the previous slide, that is the physician, patients, and peer patients relationship. Some physicians, they simply adapt to the techniques. They are not able to speak with the patients at least for 2 minutes or 3 minutes. Okay, so that is where the patients lack their patience. Okay, so that is the point here to make. And another thing is, it is to make a consensus to take a very important decision at the very important juncture. Okay, so medical humanity is not only for the sake of promoting a new field or new field of study, but it is to get the consensus from the family or from the patient at the important stage, at the important decision, and so on. And then it is called, this medical humanity can also be called health humanities. It can also be called health humanities. And then we have that it is the Sarton. He is a very well-known writer in this medical humanity, and he says that it is a new humanism. It is a new humanism. New humanism is flourished by the advent of medical humanity and so on. Yes, the next thing is, it is William Osler says, humanities as the hormones. Humanities as the hormones in the sense, when you are taking a humanity and when you have a humanism towards a person, it is because of the function of hormones. It is because of the function of hormones. It is told by Mr. William Osler. He is a professor of medicine at Oxford. And then in 1950s, the UK physician Hug Barber says, it is a medical student. I mean, he wanted to bring the values of literature and humanities to the medical students, to the the medical practitioners. And he says, very important point here, I have highlighted with the green, that is a fallible human nature of what they themselves are a part. So that means fallible human nature. To err is human, you know that. That to err is human. At the same time, a human being is tended to commit mistakes. When they commit mistakes, they are parted themselves. So in that perspective, we see that a patient person as a human being, So in that case, we have to have the idea that is a fallible human nature of which they themselves are a part. And in 1970s, the Australian surgeon, and his name is Anthony Moore, he says, and he wanted he wanted to make literary text as important to the medical fields, to the medical students, in order to bring out the awareness, and medical ethics and medical codes and so on. So these things are written through the literary text. And another point I would like to tell you is, American physician, Mr. Robert Coles, he says, again, he promotes the value of literary reading, because in the literary reading, we find imaginary characters, imaginary fictional characters in different situations, in different conditions, in different contexts, how they are suffering and how they are going to have all these ailments, how they are going to oppose. Okay, these things must be read by the medical students. Okay, that is why they can understand the real problems of people in the society. Okay. And another philosopher is where he is a very important philosopher. His name is Robin Darwin. Okay, Robin Darwin. And in Glasgow, he says that poetry is to enable clinicians to develop whole person understanding. We just that understand it is a whole person understanding in the sense. It is not that simply if you go to a particular time, I mean a particular physician for your particular ailment, okay, they will look at that only in that perspective. If you go to neurologist, they will check you in the perspective of neurological problems. If you go to a cardiologist, and they will check you in the perspective of a cardiology and related things related to cardiological issues and so on. But what he says is, Robin Downey says, it is a whole person understanding in the sense a patient person is to be understood in a different age, I mean different angles, in different stages. This is what we call the whole person understanding. First the first. And another point is, I would like to tell you is, yes, here the major journals for medical humanity, the major journals for medical humanity and leading journals in the medical humanity, we have that. It is the American Journal of Medical Humanities, and it is really it was called a Journal of Medical Humanities and Bioethics in 1980s, and then UK Journal Medical Humanities in 2000, and then Journal of Medical Ethics. Journal of Medical Ethics we have, and after that we have the Journal of Medicine and Philosophy. Medicine and Philosophy, and then we have Literature and Medicine, and then we have BMJ journals. The BMJ journals, you find a number of articles which are related to medical science and medical humanities and literature, and how literatures are related to science and medical science and so on. So these journals, please refer to these journals for your better understanding. If anybody is willing to do their PhD in our MPhil or MA project in this medical field and medical humanity, you can refer to these journals and so on. You can refer to these journals. The next slide I would like to tell you is foundation of the department. That is the medical humanity is the foundation. The first medical humanity was founded in 1973 in the University of Texas. The first time it is as a department. It was founded as a department, and after that, in the UK academic unit, which offered a MA program, in the University of Swansea. Actually, the first medical humanities founded in 1973. It is only for the sake of a foundation of the department. In UK academic unit, it is meant for producing programs like MSc in medical humanities and so on. And they focused only on the philosophical inquiry, history, medical anthropology, sociology, and literature, the visual arts, politics, and social policy and theology. And these things are related to medical humanity. And then recently, they have yes, again there is a problem, I think so. Yes, of late we have this one that is the Center for Humanities, actually medical humanities at the University of Durham. It's of late they have created. So these points I would like to tell you for your reference point of view. For your reference, these points, these foundations of the department, I would like to tell you for your reference. Yes. Now we have that it's a medicine practice as an art. Marshall Marinka, he is a general practitioner. Marshall Marinka is a general practitioner, and he has given three definitions for disease, illness, and sickness. Okay. Disease is nothing but a pathological process. You know that it is a kind of a throat infection. It's a kind of a tumor. It is a kind of a cancer of branches. Okay, cancer of branches. So it is depending. It depends fully on disease. Okay, it fully. I mean, sorry, the pathological process. I mean, what I wanted to tell you is the pathological process. Okay, and pathological process in the sense you can do it. You can the physicians can do all the process and so on, and they wait for the report from the pathologist to confirm whether this particular disease is that or not. So that is what we call the pathological process. So that is the disease. So here in the disease, the physician must see the problem, must touch the problem, must measure the problem and smell the problem. And the disease is valued from medical view. It is valid from medical view only. Then only then we can call that this is a disease. Unless we cannot call that it is a disease. And what is illness? The second point is what is illness? Illness is a kind of your inner feeling, and you feel unhealthiness in yourself. What you feel is unhealthiness and personal healthy unhealthiness, and it is interior to a person of the patient person, and it is associated with the disease, and it may be or may not be declared. Okay, it may be or may not be it may be undeclared at the point of time, and it may be a cancer, or it may be a tuberculosis, or it may be a diabetes and so on. So this is what we call illness. In the earlier before the disease, you find the illness, you feel something is unhealthy in yourself. In yourself you can feel that you may feel some kind of a giddiness, so that giddiness may be leading to some other disease, something like that. So that is what we call illness. It is according to Marshall Marinker. He is a general practitioner. And after that, sickness. What is sickness? It is a public mode of unhealth. It is a public mode of unhealth. And then it is sickness is a social role. It is a social stigma and social role. And it is a negotiated position. And especially, it is a psychiatric disease rather than a surgical one. So sickness is for psychiatry one, and illness is interior in yourself, what you feel, okay, unhealthiness, and then disease that fully depends on the pathological process. So these are very important things that you must understand. Yes. The next thing is health. What is the health? R.S. Downey says, and he has taken the definition from the World Health Organization, that is a state of complete physical, mental, and social well-being, and not merely absence of disease or infirmity, is overambitious. You find that it is a very beautiful definition for health. Health is not that it is absence of disease. It's not simply the absence of disease. Health is. The health is, if everyone is healthy, it is because of a state of complete physical, mental, and social well-being. So physically you must be very, very robust, and mentally you must be very, very robust, and socially you must be well-being. So in all these stages, if you are good enough, you are healthy. You are a healthy person. But here I tell you is shifting concept. Shifting concept is nothing but earlier person, when a person is affected, they find kind of a bacterial infection or some kind of a problem, and he becomes a patient. And then patient becomes a patient, that's all. In the clinic, person becomes a patient, and the patient is also treated as a patient, that's all. But present, what the medical humanity says, what the medical humanity and its aim which wants to project is patient to a person. Patient becomes a person, and person becomes with a good human and humanity. So that is the point. It is a shifting concept. So we cannot say that a patient, and so on. If you say the very word that is a patient itself, it will make them sickness. It will make them sickness. He see him as a person and human, a good human. That's all. So that is the point I would like to tell you. The another point is Downey's and his contribution to the study of medical humanity in through his literature and medicine. In this particular article, he has contributed four types that are very, very important. The first one is connection benefits literature. The connection of literature and medicine that will benefit literature studies and literary studies and so on. And another point is it provides entertainment value. It provides entertainment value. The entertainment value in the sense we find that literature is providing entertainment value and so on. But here, even though it is entertainment value, certain medical values and medical ethics must be there. That is the point we can have that. And the third point is we find that is potentially provides and different public perceptions. As I told you earlier, a person is from different contexts, different areas, different regions, different what should I say, places. How they come and what are their real problems and how they are narrating in different way of his ailments and so on. These things are told in type 3, and then type 4 it is helpful to the practice of medicine. And he says that it is a whole person understanding. Again, we have that it is a whole person understanding. So it is not that it is simply for the sake of only one thing. Okay, the whole person understanding is an essential one. It is an essential one, the whole person understanding. The next point I would like to tell you is medical doctor poets. Medical doctor poets. The first one we have Rabelais. The second one is Anton Chekhov. The third one is Arthur Conan Doyle. The fourth one is William Carroll Williams. The fourth one is Michael Crichton. And the sixth one is W. Somerset Maugham. And seventh one is John Keats. You know, very famous poet is John Keats. He is a medical doctor, first of all. And then Robert Bridges. He is a poet laureate, the British poet laureate. And the ninth one is Welsh poet. His name is Henry Vaughan. So all these poets, by profession, they are doctors. By profession, they are physicians. Okay. By passion, they become poets. By passion, they become poets. They wanted to write something through the poem, and it can be disseminated to the other persons in the society. So that is the primary aim of these medical doctor poets. Now I would like to give you an example from Hamlet. Okay, it is you say that Hamlet is the tragic fly is postponing things and the delaying things, and then we can have that this one is Oedipus complex and so on. But what this particular medical humanity has interpreted Hamlet in a different context, in different sense, is Hamlet is suffered from this obsessional problems. It is a kind of really the psychic problem. It is because of the psychic problem only the tragedy takes place. It is not because of the postponing things and delaying things or procrastination and so on. But the thing is, it is a kind of obsessional illness and depressive illness. It is a different perspective the scientists have seen. And Mr. A.B. Shah in Medical Ethics, it is a medical humanities. That is a journal. In this journal, I have taken a few things for your reference. That is Shakespeare. He said that this man Hamlet is unable to cope with a heavy responsibility. He is unable to cope with a heavy responsibility. And then the second point you say that the next point is Hamlet actually calls himself a melancholic. He calls himself a melancholic. all the time. No, he calls himself melancholic in the sense he is not happy with that. He's feeling depressed. And the next point shows that the next point is how very stay flat and unprofitable and seem to me all the uses of this world. And again, he says that he is not interested in living in this particular world. So it shows that the depressive illness, the obsessional features, the depressive illness and the obsessional feature, it is projected by Shakespeare in Hamlet. The another point I would like to tell is he calls Denmark a prison. You find that Denmark is a prison. He calls that it is an anhedonism. Anhedonism is nothing but he is not able to feel happiness. A person is not able to have and feel happiness is called he is suffering from the anhedonism, like that. So this line shows that he is not able to feel the happiness. And then the another point from Hamlet I would like to tell is, were it not that I have bad dreams. It shows again he is suffering from insomnia. That is he is suffering from sleepless night. Sleepless night, it is a kind of illness. It is a kind of depressive illness. If a person is suffering from the depressive illness, he is not able to sleep properly. So that is the point. So how Shakespeare has projected all these depressive illness and the obsessional features in Hamlet, you find that it is not that simply a matter of a procrastination, delaying things and postponing things and so on, but it is a matter of depressive illness and this is the obsessional feature and so on. And then Ophelia, she is going to marry him. Actually, Ophelia herself neglects his first appearance. From the beginning itself, she neglects. So in that case, he feels that social stigma. He feels the social stigma. That is the society. The sociology comes here. That's why I told you that it's a medical humanity. It's not only for this particular subject that is literature, but also it concocts. It is concocted with all the areas like philosophy and religion, psychology and sociology and so on. And then he dwells on the death and suicide. He is a devil between the deep blue sea. Okay, that is he is unable to go for death and go for suicidal activity and so on. So that is a kind of a depressive illness. And in his soliloquy, we find that it's a very, very, very famous soliloquy. That is, the famous soliloquy is to be or not to be. It is a soliloquy. And the first time he says that to be, he want to do something. And another thing is, it is not to be in the sense, again, he has some other decision. That is the ambivalence. The ambivalence technique, the ambivalence decision is there. So it is not that to be or not to be in the sense for the, what should I say, the courage attitudes. It is not like that. The first he feels to be and he has a courage, and second thing is not to be, he goes down. Again he goes down. That is the proper example for the depressive illness. Sometimes everybody has the depressive illness. In the world, who is born as a human being, everybody in this world has the depressive illness. Like this one, to be or not to be. It is a very famous soliloquy from Hamlet. The another point is, you find that a soliloquy, the second soliloquy is, oh, what a rogue and peasant slave am I. This man says, he himself says that he is having a low self-esteem. It is a low self-esteem he has it. When a person is in depressive illness, he has a low self-esteem. He has a low self-esteem. So that is the point. Shakespeare, how beautifully has written his drama, that is Hamlet. You find that. Yes. Another, and Gertrude, she herself says, my too much changed son, my too much changed son, in the sense, and she understands that Hamlet is already changed. And she wants to say that you have changed. So in that case, she uses the lines, that is, this particular line is, my too much changed son. And it has made him feel uncomfortable and so on. An acute depressive illness, not a chronic melancholy. It is not chronic melancholy in the sense, it is melancholy, you know, that it is a feel of sadness and so on. Chronic in the sense it lasts for a long time. This is what for a long time we have a disease. It is called a chronic disease and so on. But it is not a chronic one. Okay, it is not a chronic one, and it is acute depressive illness and so on. Yes, the another point I would like to tell you is thinking too precisely on the event. It's a Hamlet. It is a self-diagnosing. He himself diagnoses himself. And then another point, the narrative hue of resolution is sickled or with the pale cast of a thought. Here we find that he is unable to take a decision. He is unable to take a decision. Again, we find that if a person is suffering from a depressive and obsessional illness, he or she is not able to take any decision. That is the point here. And then it is a perfect description of depression. That is the Shakespeare's understanding here. We can have that. And Ernst Jones says, Oedipal complex is the childhood wish to kill his father. Oedipal complex. The Oedipus complex is the childhood wish to kill his father. After growing older, it is not that Oedipus complex is there in a person. Okay, it is because of the depression and obsessional illness. This tragedy takes place. It is because of the depression and obsessional illness. And then Shakespeare, we find that it is the place. This particular play is a revenge tragedy, as A.B. Shaw says. It is a play of revenge tragedy. It is not like simply a tragic play is procrastination. It is a revenge tragedy, and it is because of the illness, the mental illness, and so on. So these are all the things from Shakespeare's Hamlet. We can say it is a medical humanity that is here. These points are from the psychic point of view, the psychiatric point of view, and then how it can be rectified, how these points can be rectified, and how these points can be related to the people, those who are living in the society. So in that case, we can see this particular Hamlet. Okay, there's a drama Hamlet. So that is the one example for the medical humanity. And then another is Leo Tolstoy's The Death of Ivan Elish. You find that I would like to give you, this is a death of Ivan Elish. Ivan Elish is very much interested in, not interested, he is very much worried about what is the ailment was, and the physician considered not to say that ailment, and he says that even if he says this is the particular ailment, it is not useful one. And it is no need of clarifying. It. And then it may be, and he says it is a case of floating kidneys problem, or else a chronic intestinal inflammation, or else the disease of cecum. Okay, you know that the chronic intestinal inflammation, it is somewhat the disease like it is from stomach and so on. So disease of the cecum, it is a place in an organ which is joining both intestinal, small intestinal and the large intestinal. So that is the point here. And then it is nosological technicalities. The physician is more concerned about the nosological technicalities. What is nosological technicalities? Nosological in the sense we can diagnose through the symptoms, through only the symptoms, not from other things and so on. And then he says therapeutic poverty of medicine. There is no medicine for this. And between the patient and the between, and he say yes, and he says it is a non-friendly authoritarianism. Actually, you find, my dear friends, participants, and the patient is worried about his prognosis. The patient is worried about prognosis. Prognosis in the sense what is going to happen to his body. Okay, what is going to happen? How he is going to live. So that is the point here. He is worried about his prognosis, but the physician is vaguely is searching for his diagnosis. So you find that there is no empathy and sympathy in uh, this story. You find that there is no empathy and sympathy. The patient asked what was his ailment, but the doctor is not able to say it. It is an existential, yes, it is an existential impact. Okay, that he just think that only the nosological technicalities, not the patient's the symptoms and so on. So that is the point here. So what the problem is here, the person, the physician must have certain empathy and sympathy, and the patient is, if he is not able to know what is the ailment that is pestering him or herself, it is a really very very problematic rather than the disease. So that is the problem. So the doctor must say this is the problem, that is the problem, or else he must have certain empathy and sympathy. But in this particular story, he did not. The doctor doesn't have the empathy and sympathy towards the patient and so on. So that's the point. The another thing is, yes, we have a Lightman the diagnosis. Lightman diagnosis. It is another example I would like to tell you, and I have taken this from the source is M. Cato and A. Cato. It is a literary narrative medical practice. From this, I have taken this, and that is here. What we have is in the diagnosis. In this narration, we find that the narration, you find that after the test, we will begin some tests, and then what do you think the problem is? The patient asks. The patient person asks, "What do you think the problem is?" The doctor did not answer. The doctor did not answer, and Dr. Petro and says, "Yes, you are doing tests for some reason. What do you think is my problem?" Again he asks, okay, again he asks the Mr. Bill, he asks, "What do you think is my problem?" And he says, "It's very rare, such as leprosy, and I understand from your chart that a numbness began about 2 days ago," said the doctor, "and it was accompanied by initial loss of memory. Is that significant?" The Bill asks. The patient Bill asks, "Is that significant?" "It could be significant," said the doctor. "On the other hand, it might not be significant." You find that it could be as significant, and on the other hand, it might not be as significant. Again, this patient, that is Bill, said, "Significant or not significant?" Bill shouted and stood up. "I have been here since 10:30. When can I be treated? I came here to be treated." The doctor said, the Dr. Petro said, without raising his voice, "Treatment. Treatment, that's all. Treatment." You find that, again you find that there is no the proper asymmetrical relationship between the doctor and the patient. So that is the point. Earlier we saw that point is to maintain symmetrical, yes, to maintain symmetrical relationship between the doctor and the patient. But here we find only the asymmetrical relationship between the doctor and the patient. So in order to annihilate the asymmetrical relationship between the doctor, the physician, and the patient, we have this study called medical humanity, first of all. So that is the point I would like to tell you. Okay, you may think that medical humanity, in the sense, the literary people are going to give some techniques, and they are going to give some diagnostic techniques, they are going to give some sort of medicines and so on. It is not like that. The point is to maintain the symmetrical relationship between the patient and the doctor. Okay, the patient and the doctor. So that is the point here I would like to tell you. Yes, from this Lightman's diagnosis. And then another thing is you have that the important syndromes after the characterization of a literature. After the characterization of a literature, they have, in medical fields, they have certain syndromes. Okay, so how literature is contributed to the development of medicine. As earlier I told you that literature's study and how it is going to contribute to the medical fields and medical science and so on. So in that case, we have certain syndromes and their characterization and the writers of that particular character and the works. We have that. Now we can have that. The first one is Rapunzel syndrome. It is a trichobezer and trichotillomania. Trichobezer and trichotillomania, that means it is related to the long hair. It is related to long hair in the body, and people are urged to pull out the hand and the body is a kind of it's a norm. It is every time. Often they are doing that kind of attitude. So that syndrome is derived from the fairy tale. That fairy tale is written by Brothers Grimm. It's written by Brothers Grimm and so on. The another syndrome is Othello syndrome. Othello syndrome is the delusional jealousy. Delusional jealousy, it is a kind of a psychology, you find that. The delusional jealousy and groundless accusation of his wife. If a person groundlessly accuses his wife, he is suffering from the Othello syndrome. This Othello syndrome is taken from Othello by Shakespeare. Shakespeare's drama, that is Othello. And then the third one is Lady Windermere syndrome. It is the character of Lady Windermere syndrome is mycobacterial lung disease. Actually, it blocks the breathing problem. It blocks the breathing. Okay, they have a shortness of breath. This syndrome is derived from Lady Windermere's fan. Okay, it is also written. It is written by Oscar Wilde. And these characters are contributing to the development of medicine. Okay, at least in the name of names. At least in the name of names. Okay, and then Peter Pan syndrome. It is Peter Pan syndrome in the sense, if a person is not able to grow maturity. Okay, grow maturity, and then if he is not able to accept the social norms. Okay, if he is not accept the social norms, and he is opposing the accepted norms in the society. So that is what we call the Peter Pan syndrome. It is derived from the little white bird. The author is J.M. Barrie. And the fifth one is Mowgli syndrome. You know that. You would have seen that. You would have read that. This Jungle Book, and this particular syndrome is taken from, this is a Jungle Book, that is a Mowgli syndrome. The Mowgli syndrome is nothing but it is a children with a weak mental attitude. They are suffering from weak mental attitudes and then raised by wild animals. Some kids are raised by the dogs, pet dogs and so on. So that is the syndrome. Okay, that's a Mowgli syndrome. It is taken from the Jungle Book. The another sixth one is the Cinderella's syndrome. It talks about the adopted child and how he or she is abused, and how that particular adopted child is abandoned by the adopter. Okay, in the society. And then this particular Cinderella's syndrome is taken from fairy tale character. It is written by Charles Perrault. Okay, and the seventh one is Pickwickian syndrome. This Pickwickian syndrome is excessive obesity, and is apnea and breathing interruptions during sleep. During sleep they have some kind of breathing problems and so on. Yes, sleeping interruptions. So this syndrome is taken from Pickwick Papers, and then it is written by Charles Dickens. And then the eighth one is Huckleberry Finn's syndrome. Huckleberry Finn's syndrome, it is a person is having inability to adjust the things socially and psychologically. Psychologically, they are not able to adjust the things. They are not going with the society. They are not going with the norms. So if the person is suffering from this particular syndrome, it is called Huckleberry Finn's syndrome. And this is taken from Huckleberry Finn. It is written by Mark Twain. Mark Twain is called American Chaucer. He is a Chaucer-like person in America. And the ninth one is the Dorian Gray syndrome. Dorian Gray syndrome, in the sense, it is a difficulty in dealing with aging. Difficulty in dealing with the aging. At the same time, he or she is very concerned about the cosmetic procedures, and making a very tiddy and applying some powder and so on. This is what we call that the Dorian-Gray syndrome. This Dorian-Gray syndrome is also derived from the picture of Dorian Gray. The picture of Dorian Gray, it is also written by Oscar Wilde. And then Alice in Wonderland syndrome. Another syndrome is called Alice in Wonderland syndrome. That is, again, we find that it is the problem in visual image distortion. The problem in the visual image distortion and neurological disorder. If a person is suffering from this visual image distortion, he is suffering from the Alice in Wonderland syndrome. It is taken from Alice in Wonderland. It's written by Lewis Carroll. It is written by Lewis Carroll. And then we have this Clevin-Levin syndrome. It's a hypersomnolence. Hypersomnolence, and then it is a hyperphagia. Hyperphagia in the sense eating a lot of things. Okay, eating a lot of things. And then hyperinsomnolence is nothing but you're sleeping for a long time. Sleeping for a long time. So many people know, some people know, like including me, I am also suffering from this Klein-Levin syndrome. Yes, and then it is taken from Rip Van Winkle, and then it is written by Washington Irving. And the last one, that is the 12th syndrome, is Lady Windermere syndrome. And this syndrome is it is related to the mycobacterial lung disease, and immune system is compromised. It is also taken from the lady, and then it is Oscar Wilde. It is also written by Oscar Wilde. You find that, my dear friends, here. You find that is Oscar Wilde. Third one is Oscar Wilde, and again you find Oscar Wilde, the picture of the Dorian, and the last one is also Oscar Wilde. So this man is contributing more to the medicine field. So he has written a number of things about the human nature, and also it is about the psychological issues and so on. So the next point I would like to tell you is, you find in this slide, it's a works writer description, and certain books that talk about medical field, the illness. Certain books, certain writings that talk about medical fields and illness. Number one is the works that the best physician is also a philosopher. It's a CAD 180. C, if you put C before the year, it is called circa. That is the not in the proper time, and not in the proper years and so on. Okay, that's Galen is the writer. And in this particular work, we find that the Greek Gospels are related to medicine. And the second one is, you know that it is a very important book is Religio Medici. Religio Medici, that is a religion of a doctor. It is written by Sir Thomas Bond, and this particular book that deals with the revolutionary book in Renaissance, and also it is related to the literature and medicine. It is related to literature and medicine. The third one is A Country Doctor's Notebook. A Country Doctor's Notebook. It is written by Mikhail Baglau, and you find that the themes are recurring themes like cold. Recurring themes like cold. If you want to have your research on these, you can do it with the medical humanity. So nowadays it's very, very blossoming. Okay, it's a blooming one, so that you can have this. And then the fourth one is the Doctor Stories. The Doctor Stories, it is written by William Carroll Williams, and which talks about the medical work in creation of literature, and it talks about the clinical practices. And the fifth one is A Fortunate Man. The Fortunate Man is written by John Berger. John Berger, we find that here the theme is a physician is visiting clinic and visiting a home visit. So in between what the problems he has, all these things are dealt with this particular book called that is A Fortunate Man. And then the bell jar, you know that you would have come across this, and Sylvia Plath has written this. In this particular bell jar, it talks about ECT and psychiatry. ECT, that you know that it is an electroconvulsive therapy, and especially for psychiatric medicine and so on. And the seventh one is The Man Who Mistook His Wife for a Hate. Okay, it is written by Oliver Sacks, And in this particular book, what we have is brain's functions and different areas of medicine. It's a wonderful book also. Oliver Sacks, The Man Who Mistook His Wife for a Hate. You can go with that for better understanding. And then the eighth one is illness as metaphor. Illness as metaphor. Susan Sontag. It is talking about tuberculosis. Tuberculosis, and you can mix with the tuberculosis, this medicine with the literature in your research and so on. And the ninth one is Darkness Visible, a memoir, a madness. It is written by William Sterron. It talks about the forensic examination. Forensic examination. It is a very interesting book also. Okay, it is a kind of a thrilling and interesting one. Forensic examination. And another thing is on immunity and inoculation. That is EULA BIS. EULA BIS. It talks about the vaccination, how vaccine was produced and how it was administered to a person and so on. So these things are dealt with this book that is on immunity and inoculation. So these are the major works. These are the major works which deal with on illness and medical science. So if you have a time, you can go with this to read this. And then, yes, I think I have given the references. I have taken these points from the Guardian, the Guardian Journal, and then the Journal of BMJ, okay, and then research publications and medical humanities and so on. So from these sources, I have taken my points and I explained to you about what is medical humanity at the introductory level today. Yes, with this I conclude and complete my presentation. Thank you very much for participating and attending this. Yes, thank you. Queries, please. Queries?
It's a very informative session, sir.
Yes. Dinesh?
Sir, சொல்லுங்க sir.
Yes, give her a link. Someone is asking some questions, I think so.
Sir, உங்க screen sharing மட்டும் கட் பண்ணிருங்க.
Okay, okay.
Sir.
Arun, sir.
Wait, just a minute. Yes.
Dear participants, any questions?
Excuse me, sir. This is Chinnappan.
Yes.
Can I ask you, sir?
Yes,
sir.
definitely.
How are you, sir?
I'm fine, thank you. How are you? Yes.
Very good, sir. I'm really proud to say that I was your student.
Okay, thank you. Thank you.
St. Joseph College. Do you remember, sir?
Yeah, definitely.
Okay, thank you, sir. What? Of course, I listened to everything from top to
From the
top.
beginning. Okay.
Yeah, from the beginning. Okay, it was very informative and effective. And only one question that I would like to ask you, sir.
Yes, definitely.
Is the same medical, informative in the Indian literature? Because you dealt with everything in the American literature.
Okay.
And is the same?
Yeah, if you find medical related things and medical related illness or else some psychiatric problems in Indian writing in English, or even the British literature or New Zealand literature, or in Sri Lankan literature and any literature, Australian and Canadian literature, you can bring it to this medical humanity. It is not that any hard and fast rules and so on. Even in poem also you can have that.
Okay, thank you.
Okay, thank you. Thank you, Chinnappa.
Sir?
Sir, one more question, sir.
Yes.
Sir, and nowadays, we are suffering from corona here in the all over the world. Is there any related informative in any literature about this corona?
Corona, it is not yet confirmed. People can say that already it is predicted in Chinese literature or something like that. But as far as I am concerned, it is not yet fully predicted. It is it is a kind of the statement on the surface level it is given, not in the deeper level. So in that case, I'm not able to say confirmly and definitely.
Okay. Thank you very much,
Thank
sir.
you. Thank you.
Sir,
Sir, good morning, sir.
sir,
Yes.
thank you for this session. But I would like to ask a question as the syndromes that you were talking about, the like
You are
Alice
from?
in Wonderland.
You
I
are
am
from?
Punjab. I am from Punjab.
Okay.
The syndromes that you were talking about, like in Alice in Wonderland, Mowgli, and all
Yes.
these are fantasies. Don't you think that
Fantasy.
fantasy is somehow related to these syndromes, or a writer of a fantasy is suffering from some kind of syndrome that he produces
It
characters
may
like
be.
this?
It may be the writer of that particular syndrome. He might have suffered. So he might have suffered. That is why earlier I told you that the humanity is the hormones. The humanities are the hormones. How the hormonal changes inside the body, it may influence a person's writing. It might be. So
Yes,
we have,
yes.
we have to read that the biography of the author in the deeper sense. The analytical sense, we have to give the reading of the biography of the author. So in that case, we can get it the answer.
Thank you, sir. And one more
Thank you.
thing, like we are talking about patient and person relationship. Can this
Yes.
relationship, you were
Sorry.
talking about the patient and doctor relationship.
Yes. Yes.
Can such relationship be thought in terms of patient and nurse, patient and atmosphere, patient and
Yeah,
the tonal
definitely. That is the clinical atmosphere. In total, I can say that
clinical
it is,
atmosphere?
yeah,
Yes.
it is in the clinical atmosphere. So whatever the person, attended, the nurses and so on, the receptionist, they must have that relation, the good relation between the patient and the doctors and patient and the attendants and so on. So it should be there. So that is what we call that medical humanity.
Thank you, sir.
Thank you.
Sir, good morning, sir.
Yes, good morning.
Sir, I'm Gopinath from Madurai.
Yes.
Sir, does medical humanities talk about only illness, sir? What is the other things that it talks
Yeah,
about?
not only illness, but I have taken for the sake of understanding, for the sake of explaining to you. But not only the illness, but also you find that the psychiatric illness and then sickness and then the cancer. No, I wanted to give you the writers of cancer, but so I mean somehow I left it. But you find that cancer illness, and then a tumor illness, and you find any kind of medical illness. If you find the cross reference in your reading in a novel or a fiction or in a poem, that can be interpreted as a medical humanity.
Oh, okay,
Not
sir.
only this particular illness, but also any kind of
Okay.
medical problems.
Okay, sir.
Thank you.
Thank you, sir.
Hello, good morning, sir.
Good morning.
So my query is, does trauma studies
You are
directly come
from?
under the? So my name is Gayatri. I'm a research scholar from Bharadasan University,
Yes, very good.
University Department.
Okay.
So does this trauma studies directly come under medical humanities?
Which one?
Trauma studies.
Yeah, definitely.
Okay.
Definitely, because the psychology is there, no.
Yes, sir. Yes.
If you say trauma studies, there is a psycho. It is the trauma studies is it is based on psychology and psychiatric attitude.
Yes,
So
sir.
in that case, you can include that trauma studies in medical humanities.
So my actual query is, when we approach trauma studies in a research way, we have to deal with psychotic analysis, psychology, and other related terms, right?
Definitely.
Okay. Then doesn't it come directly under this medical procedure, or do we
Which-
have to? When we deal
Yes.
with psychology, it is definitely a medical term.
Yes, definitely.
Directly comes under medicine.
Yeah, medicine.
Okay. And we are dealing with literature.
Yes.
So while focusing on our research, are we supposed to bring up medical conditions and everything and try to fit in the literature, or are we supposed to just focus on the psychological terms in a very superficial way and connect it with literature?
Actually, whatever you do now, first of all, your area of research is literature, first of all.
Yes,
The
sir.
broad area and the very important area of your research is literature.
Yes, sir.
In the literature, how you are going to encounter the trauma studies and the character of this ailments and illness and so on, you can bring it to your research, and your topic should be something related to literature only, not that fully on medical. Fully
Yes,
on
sir.
medical.
Yes.
And
Yes.
it is not fully on medical, but it is, say, for example, psychological reading to some writers. Okay, the
Yes.
philosophical reading to some writers,
Yes.
and then we can sociological reading to some writers. So in that case, you can have that only the in the title. You should not fully focus on medical terms and medical
Yes,
terms, because we are going to do our research in literature. But
Yes.
in the what should I say? Inside your chapterization and all, you can give more importance to psychology and trauma studies and medicine and so on. But the title, it should be very, very focused on literature.
Literature. Yes, sir.
Literature.
Sure. Thank you, sir.
Thank you.
Dear participants, any other questions? Please ask.
Hello, sir.
Yes.
Sir, this is Ajit from Chennai.
Yes, Ajit from Chennai. Yes, I have seen you. You have attended my webinar already, I think so.
Yeah, sir. Many times I have attended.
Ajit.
Myself.
Yeah, good.
Of course, sir.
Good.
Yeah, sir. I have a question to you, sir.
Yes, definitely.
Hello.
Yes. Go ahead with.
Sir, can we add this medical literature along with emotional constraints? Especially
emotional things you can have
aspects.
it. You can add emotional point of view also. You can have that. Emotional is
to be precise. Actually, emotional intelligence. I'm talking about.
You are talking about Howard Gardner's emotional intelligence.
Yes. Can we link with?
Yeah, you are talking about Howard Gardner's emotional intelligence. Emotional intelligence. It is what should I say? How you are going to channelize your emotion into an intelligent. Okay. So in that case, you may not prolong your studies. What I feel personally is, you may not prolong your research studies if you apply emotional intelligence. We can bring it. It is not a problem at all. You can bring that emotional intelligence, because intelligence is a part of psychology, and a person's intelligence is also measured from some techniques in psychiatry, in psychiatric medicine. In psychiatric medicine, they are going to measure a person's intelligence. Small kids are going to psychiatrist for their measuring of about their intelligence and so on. So in that case, it is very, very precise, and you must be very careful in relating the emotional intelligence to literature. It's very, very careful. You must be very, very careful in bringing out the emotional intelligence. Howard Gardner's emotional intelligence.
Okay. Thank you, sir.
Okay.
Hello, sir. Good afternoon.
Yes, good afternoon.
Sir, my name is N. Sumanshali, and I'm speaking from Odisha.
Yes.
And I'm an active scholar.
Sorry, I would like to tell you. That it is not that Howard Gardner. It is a William Goldman. Okay. Multiple intelligence is written by, and they are related to multiple intelligence are related to William Goldman. Not that Howard Gardner. Howard Gardner is a multiple. Some other things. Okay, I am very sorry for that. Yes, I have made it correct. Yes.
Thank you.
Okay. Yes, go ahead with the question.
Hello, sir.
Yes.
Yes, sir. Sir, actually, I have a question for you. I wanted to ask that you are talking about narrative medicine in English literature. Could you please throw some light on John Keats's The Ode to Nightingale? Because even in that case, Keats has talked about the Nightingale, attributing it as his mode of relief from all his discomforts. So
Okay.
actually, my question is that in that case, how would you consider that particular activity as a narrative medicine? Is there any
Actually,
political?
I am actually my topic is changed. That is medical humanity. Okay, medical humanity is it is not that.
Yes, sir. Because you are adding English, sir. Actually, because you're adding English literature to that, so I was little curious about that thing to know that he used to say
It's
that
to
that is
the
a
point
kind
of
of medicine
through
to
the
me.
point of view of emotion, through the point of view of emotion and emotional concepts, we can view that kid's poem through the emotional only.
Yes, sir.
So if you say that
Yes, sir.
emotion, yes,
Because John Keats is also telling that Nightingale's song to him is a kind of a medicine in order to cure all his morbids.
it's his perception. It's his perception, and also there is no direct link here in this poem. Okay, there is no direct link or any other catchy word or terminology in this particular poem. What he feels, that is the emotion. He wants to escape from his emotion, and he wants to get cured from the nightingale. Okay, so that means only in the point of view of emotion. So not that the direct terminology is given from medicine, not that the direct administration from medicine. It is his perception what he has. That's all. So in that case, it's somewhat difficult to give in the narrative medicine and in the narrative medical social, medical humanity.
Yes, sir. Actually, yes, I understood your answer, and I'm happy about that also because I just wanted to know that whether there is any political agenda behind that. Because practically, we are talking about medicine, narrative medicine. Then John Keats is also no less to be discussed. That is why, sir. But I'm very happy with your answers, sir. Very thank you.
Thank you. Thank you.
Sir, Dinesh sir.
Yes.
Sir,
Participants, any questions?
dear participants, if you have any questions, you can ask right now.
Good
Actually,
morning, sir. I'm Rayson from Allahabad. And my question is that can it be said that at the essence of, in every post-colonial literature, medical humanity is the essence of every post-colonial literature? Sorry.
in post-colonial literature, you should not think that this is post-colonial literature. When you talk about medical humanity, first of all, you must have that in your mind. When you talk about medical humanity, there is no need of post-colonialism and post-modernism and narrative literature and something like that. But you just uh, think that this is a literature. This is a piece of literature. In this particular piece of literature, what are the characters are there and how they are interconnected with one another according to the medical narratives and medical humanity and so on. And after that only you can see that this is the text from post-colonialism. This is the text based on post-coloniality, post-colonial writing and so on. And then you can relate that ideas of medical humanity found in post-colonial text with this post-colonial narration. So ambivalence is one of the techniques in post-colonialism. You know that ambivalence is one of the major concept in post-colonialism. First we like and then we hate. First we want. The second thing is we do not want, as it is in Hamlet, to be or not to be. So in that case, you can have that this medical humanity in your post-colonial writings. So yeah, whether it is a post-colonial writing or post-modern writing or else a structuralist writing or deconstructive writing, everything it's all whatever the thing, let it be. But it is a piece of literature. In this particular piece of literature, how you are going to dig out the medical humanity, how we are going to view through the medical lens. Okay, medical lens, how we are going to see that. In that case, you can interpret. So that is the point.
Okay, sir. Thank you.
Thank you. Actually, in the previous question, I mean, 2 or 3 persons ago, and I wanted to tell you, it's Howard Gardner's multiple intelligences, but this emotional intelligence is by William Goldman. So I wanted to make it clear at this time also. Yes, next. These
Sir, good
ideas
afternoon.
used, yes.
Sir, good afternoon.
Good afternoon.
Sir, this is Satya from Kumbakonam.
Yes. Good
Sir,
afternoon.
very informative presentation, sir. Thank you for that
Thank you.
presentation. I just want to clarify one thing, sir.
Yes.
You said no, this medical narrative.
Yes.
Actually, Jhumpa Lahari, I think her in her short stories,
Mm-hmm.
there is one story, treatment of BB Haldar.
Mm-hmm.
So in that BB Haldar actually who are affected by certain disease like fits.
Fits.
So can we? Yes.
Mm-hmm.
So can we add this short story under this medical narrative?
Definitely, you can add this. As I told you, the
Because
direct.
in her other stories also, she
Mm.
dealt with this psychological problems like
Mm-hmm.
alienation, nostalgia, and other things.
Mm-hmm.
So can we add those
Yeah, yeah.
stories under
See,
this medical
I see.
narrative? Or,
Actually, we saw that Hamlet was earlier. That is the tragedy. It was a tragedy,
yes.
and the tragedy was because of the what should I say? This procrastination. And after that, now we see that the same text, the same drama, Hamlet is suffering from medical
Yes.
illness, and then obsessive problem, delusional problem, and so on. So it is because of the illness, the psychiatric illness, this tragedy takes place. So you see the difference between the earlier view of the same text and the present view of the same text. So in that case, we can interpret that particular text with the proper medical terms, and how characters are involved with the physician and the patient, or else the patient with the clinical environment, clinical atmosphere. So if you find clinical atmosphere and physician, and clinical atmosphere with the patient, and if you find all these things, you can definitely bring into this medical humanity,
Yes.
irrespective of genre. Either it is a poem or essay or short story or novel or fiction, anything else. Definitely you can bring it.
Is it a new emerging
Yeah,
field,
emerging
sir?
trend only.
Interdisciplinary.
Yeah,
Okay, sir.
interdisciplinary.
Medical
Nowadays, the people
humanity.
are asking what is the your area of study, whether it is based on interdisciplinary and so on.
Yes, sir.
So that we can do it. We can
Yes.
do something for the society through this particular medical humanity and
Yes.
so on.
Thank you,
Thank
sir.
you.
Thank you so much for your
Thank
session.
you. Dinesh?
Sir,
Yes, Dinesh Kumar. Any other question? Or,
Hello, sir.
yes? Hello.
Hello. Good afternoon.
Good afternoon.
This is Durga.
Yes.
Okay, I just got a doubt. We have this biosemiotics. Can we connect biosemiotics with this field?
Biosemiotics with this field in the sense the genetic codes can be used here. Genetic codes and the way you use that semiotic knowledge and semiotic utterances, and the language part is also involved here in this semiotic part, and then the genetic codes, the behavioral codes that are involved in this medical humanity. So in that case, it is somewhat a difficult area also to interpret in this medical humanity.
Okay, just one more thing.
Yes.
I find whenever we do this medical humanities also with literature, we look into the text only. So in that way, it is more like semiotics, analyzing the word text and all, it is semiotics. So like medical humanities, when you talk about the problem and issue of a human being, that is more like a biosemi yeah. So in what way you can differentiate this one? I feel that both are almost the same.
Both are
What
almost the
is that,
same in
sir?
the sense. In the medical, in the biosemiotics, we fully talk about and concentrate only on the language part first of all. Language part,
Okay.
how that narrator produces the semiotic relevance, semiotic understanding, and so on. So that is entirely different. Actually, I tell you that. So in that case, uh, biosemiotics with the medical humanities relevance, if you find that, you can bring it to the medical humanity.
Okay. And just a piece of appreciation. It is really awesome session from the beginning till end. It was highly informative, like new area. So I'm really happy about it, just being a part of this seminar. So thank you so much
Thank
for
you.
this topic.
Thank you.
Hello.
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 Can you hear me?
Hello.
Hello.
Sir, உங்க
Yes,
வாய்ஸ்
ma'am.
கிளியரா
Yeah,
இருக்குன்னு பேசுங்க மேம்.
yeah, please ask question. Your voice is audible.
Yes, so my name is Nidhi. I'm a resource scholar from Kerala.
Hello.
And
Please little bit louder.
my name is Nidhi. I'm a research scholar from Kerala.
From
Kerala.
Kerala. Okay.
My question is, when we take a novel which contains both psychological and mythological elements, for example,
Psychological
and mythological elements.
or mythological elements. Okay.
For example, in an American novel, A.C. Warner, it's an American novel, and the heroine is considered to be a snake woman. But at the same time, she experiences some psychological
Okay.
behavior like neurosis, then psychosis, depression, repression,
Okay.
etc. Can medical humanities be applied to this novel? Because it contains a mythological character, and the mythological character is suffering from the psychological repressions and all. So, can we apply medical humanities to this novel?
Yeah, definitely you can apply that.
Okay.
See, in a particular drama or a fiction, or novel, anything else, any piece of literature, you can have it. You find different themes, you find different techniques, you find different fields, like as you said, that is psychology and mythology. Even some of the text find philosophy also, you find that. So you need not to concentrate on philosophy or this mythology. The mythical characters can be involved in medical humanity.